MedEssist has built a solution that enables, at the very root of it, community pharmacies to turn into these very comprehensive healthcare sites. And the reason we're doing that and the problem that it really solves is helping healthcare become more accessible. It's really serving a need that we are kind of seeing everywhere, that, healthcare systems are absolutely overburdened. There's a lot of staff burnout. There's a lot of healthcare workers that are kind of just feeling a lot of exhaustion. And despite them loving what they do and loving their profession, they're feeling a lot of tire and struggle from the healthcare system not meeting them where they're at. And so, what MedEssist does is it enables community pharmacies to sort of get more involved in the patient demographics and the patient communities they work around. The reason for that is because pharmacies have sort of drawn attention to themselves over the last year, since the pandemic, because they played such a huge part in delivering COVID-19 vaccines and helping communities all across North America and all across the world really help alleviate the issues that they were coming to terms with during the pandemic. They were helping distribute vaccines, scale them, scale healthcare delivery all across the country. Right here in Canada, there were these mobile clinics that were everywhere through buses and community health centers. And that's something that a pharmacy has been uniquely leveraged to tackle, because they are a healthcare site that's on every block around the world. And so they're kind of unique in that way. And so MedEssist really enables them and enables us to address this problem in the healthcare system, which is healthcare accessibility. So the primary goal and motive behind MedEssist's journey is really to enable pharmacies to reach their communities in better ways. And it's to tackle the biggest challenges in the healthcare system. And what I mean by that is, if there's a new healthcare device or a new medical device or a new therapy or new medication, you wouldn't really know about it other than if it was made accessible to you from a local site. Now, if you were sick right now and you tried to get healthcare, you would try to go to a walk-in clinic first, and the walk-in clinic wait times would unbeatably beat you down and not let you see someone immediately, and your next place would be the pharmacy. So what's unique about this is, if you went to Little Italy in Toronto or you went to Koreatown in Calgary, there would be a pharmacist there that speaks that language and knows that immediate community really well. And so you'd be able to talk to someone that kind of speaks your language, understands what you're looking for, and would be able to tell you about something new that's launched in the healthcare system, whether it was a new therapy or a new device or anything you needed. And so even though you wouldn't be able to get access to what you needed right away, you would get to speak to a healthcare professional. And that's really what we want to enable. Our primary goal is really enabling these healthcare sites so that they can start getting more involved in healthcare deliverability. If everyone started to utilize their local pharmacies more, I think it would have a phenomenal impact on the healthcare system. Because if you think about it, and I can look at a few data points just here in Canada. So in Ontario, they started minor ailments prescribing in January of 2023, January 1st. And I think over the course of last year, they did little over 600,000 visits across just the province of Ontario. And the province of Ontario has 3,600 pharmacies. So if you think about these 600,000 plus visits, those are 600,000 plus visits that have been saved from emergency rooms, walk-in clinics. And when those patients are going to a pharmacy instead of taking up that spot at a walk-in clinic or an emergency room, that opens up the spot at the emergency room for someone with more complex care to actually get in and see a surgeon or a doctor or someone that they need. And so if as a population we started to do that more and more, I think it would lessen the burden on the healthcare system just a little bit. It's not a foolproof solution. Like, everyone in Canada deserves to have a family doctor. So that's not something we're trying to replace. But at least we can lessen the burden on the healthcare system by sort of diverting some of these less complex visits to local pharmacies, where you can get care faster, more seamlessly, and almost always accurately, and you'll get the solution you need. So I think that would be a big help if people started using their local pharmacy properly. So, what MedEssist really does to bridge the gap between a traditional pharmacy and making them feel like a modern practice is enabling them to use technology to kind of cut that visit down in a briefer time. So again, if you're a patient, or you watching this call, watching this video, really, anything we do, we've tended to find routine or consistency around what we do, whether it's changing the tires on your car, whether it's going to pick up your groceries at a certain time, whether it's your kids coming to pick up, whether the local school picking your kids up in the morning. You've got routine, you've got consistency, you've got some expectations that have been set for that visit that you want to enable or that thing that you want to achieve. And that has been missing in pharmacy because they've just had a lack of technology that works for them, because their practices are so unique. And being able to build this out for them has enabled them to spend more time with the patient and just doing the things they love, really. So you're filling out that patient intake form before you come to the visit. You're pulling out documentation or your health card number or things that you need that are important or vital to the visit ahead of time. So you're cutting that time down that you're spending with the practitioner or on that visit practically in half, really, and you're saving yourself time. So if you've taken all of this trouble to get dressed and get your kids dressed and drive to the pharmacy and pay for parking, you have that guarantee that you're going to see the practitioner. You're not leaving it to chance. You're not waiting in a room. You're not hoping that they're going to be free. You want that guarantee, and that's really kind of some of the benefits of technology, is being able to do all that faster, more efficiently, better, and just have an overall better experience for patients. We facilitate, I think, more than 7,000 visits from patients to pharmacies all the time, because a patient will say, I'm looking for a pharmacy near me, and a MedEssist pharmacy will pop up. And we've facilitated more than 3,000 Google reviews that patients have actively taken the time out of their day to go fill out a Google review for a local independent pharmacy because they've had a better experience there. And a big part of that better experience is making it easy for them, making the visit shorter, showing them that you value their time as much as you value your own.
Favorite thing being a pharmacist is I'm able to help my patients. I enjoy my job. Whenever somebody needs my help, I'm always available. When their doctors are not available or other healthcare professionals are not available to talk to them, when it comes for mental health or prescribing services or any emergency medication related questions, answers, I'm able to answer their questions and making them more confident for using their medications. So I enjoy a lot being a pharmacist. It's very common that patients are coming in the pharmacy and they are looking for family doctor or walk-in doctor sometimes for their current situation, and they want to talk to some healthcare professionals uh, for their healthcare need, and doctors are not available. It is very unfortunate in Alberta. It's a shortage of physicians, or maybe they are overloaded with a work that they are not able to see so many patients in a day. In that case, pharmacist is playing a very big role uh, for helping them for their current need and in a timely manner. So so patient can get their healthcare need on time. It makes a big difference when patients are feeling more comfortable with their pharmacist, so they are able to share their personal feelings and their personal problems more comfortably in a confidential environment. They are not able to feel comfortable with those big chains because they see different faces all the time. The pharmacists are changing because of the management issues, and some pharmacists are not even allowed to talk in different languages. When they work with big chains, they have to talk in one language. That makes a difference being a locally owned independent store versus big chain pharmacies.
So, in terms of challenges that maybe a local independent pharmacy would face that perhaps a corporate store or a larger big brand store wouldn't, is they just don't have the same marketing and advertising budgets that a lot of the big corporate stores do. A lot of big corporate stores have massive loyalty programs, partnerships with other vendors in the general convenience grocery store ecosystem. They have access to large budgets where they can do ads on TVs, billboards, radio, and many more forms of advertising that a small independent business owner would not have access to. So, one of the ways that MedEssist helps address or equip local pharmacies with being able to participate in the healthcare system in this way that I've been describing is we put a comprehensive tool in their hands that helps them actually both market their services, communicate with patients, collect patient intake forms, and actually do everything that's holistically needed to make that appointment a success. So there's roughly 12,000 pharmacies in Canada, and maybe about 9,000 of them or so are independents. And independent pharmacies don't have the same support as other small business owners in your local strip mall. So what we're really doing is just empowering them with both business tools, clinical tools, marketing tools to make sure that they can participate in not just being a successful business owner, but being a successful pharmacy owner. I think some of the instances where MedEssist has made a difference in the lives of patients or communities it serves is really through our customers, our community pharmacies. So our pharmacists have told us that because we've built this, they've been able to help X or Y patients. And they pass us those stories all the time, which is, I think, a big part of what helps the team work at the caliber that we work at, because so many customers tell us this. They tell us that their patients have a good experience online with them. Their patients have said this or their patients have said that. And so, one story I can speak to really well is pre-pandemic when we were trying to figure out whether we could help solve the distribution and supply chain problem that we were going to have with COVID-19 vaccines. We had a very small pilot. I think we had like 60 customers across Canada. We served about 30,000 patients or 35,000 patients, something around there. But 10,000 of those patients were actually patients that were immunocompromised. They were patients who had greater needs. Basically, they were patients we should worry about because they had multiple conditions that they had to be conscious of. They were cancer patients. They were patients on very important therapies. So you really needed to take care of them first before you took care of everyone else because they were just more high risk. And we heard from all of our pharmacies that that's what we did really well at a time where there was total chaos in the environment during the pandemic. Many of our pharmacies said that because we were able to build in a way that helped them tackle or include any patient, whether they spoke English or not, whether they had a cell phone or not, whether they had an email or not, whether they spoke English as a first language, whether they only had a landline or only had a computer at the local library, they were able to be inclusive to all of their patients. And that was very eye-opening for our team. I think it really showed our team the power of why building something intentionally matters and who it matters to. So I think that was an experience that showed us what is the impact on patients and patients in different communities.
MedEssist has created a lot of online tools that saving a pharmacist time. For example, if I'm doing consultation on the Ozempic, like one of the injectable medication, my job is to educate patient about what this medication is doing, how it will help them for side effects, and in terms of mechanism of action, how to use it. MedEssist has created even tools that I can hand out to patients. They can watch the videos after going to home, and if they forget my consultation, they can repeat it. So MedEssist has created a lot of online helpful tools that is helpful for me and for patients to remember properly what we talk about. And even though they forget, they don't need to come back. I can simply send them the videos or document that they're looking for. When pharmacist is doing consultation for any medical condition or any travel consultation or any immunization, priority immunization question answers. Majority of the tools available online or different sources, I feel like it is generated by generic question answers, not medication specific or not medical condition specific question answers. MedEssist has created those question answers medication specific or medical condition specific, and I think it's generated by a pharmacist. So every single medical condition question answers or medication question answers, when it's generated by a pharmacist, we know that what we want to ask for that particular consultation. That that makes a huge difference, that I don't miss any point in my consultation or my communication with a patient. Uh, and I think those question answers should be generated by a pharmacist only, not through the online other sources.
So Michael is my co-founder, and he is the real reason that I ended up co-founding MedEssist alongside him. Really, is I met him in very late 2018, and a lot of people don't know this, but we actually went door to door on foot for a whole year, and I think we visited roughly 3,000 pharmacies in a year. We would start at 6:30, 7 a.m. in the morning. He would pick me up. We would go to a local Tim Hortons, get a coffee, and then just walk up and down the street. And we visited as many pharmacies as we possibly could, as many as we could talk to. And we'd really look at how they were doing things, what they were struggling with, what they found hard or challenging or irritating, and we would just have conversations with them. Um, and Michael, at this point, had been a pharmacist for many years and a pharmacy manager for many years, but he never went in thinking he knew the answers to everything. He was very curious. He was very focused on nailing down consistencies around the problems that pharmacies were facing. They were always left out of the healthcare system. They were always on the periphery, having to debate whether they were part of primary care or not. They were always left out of the loop, even when the pandemic came and public health messaging came and national communication came. They were always left out. Nobody asked their opinion. They were always given tools that people just assumed would be helpful to them without asking them what their opinion was or how it impacted them or how it affected them. Because no one really spent the time talking to them or realizing that they were open 6 days a week and sometimes 7 days a week. Everyone kind of put them in a box and just didn't care about them. And what was really unique about what Michael did and what was inspiring about Michael was that he really cared. Like, everything he built was so intentional. We build and move so fast at MedEssist that we literally have products going live every single week. And that has only slowed down for consistency's sake and for the sake of our own team having to manage him, because he's so fast and he is so incredible. But he used to deploy new products every second day or every third day. And sometimes he would start a call with saying, okay, guys, I launched this product that no one asked for. But it's out there. Let's see what happens. And without fail, we would have customers using it. And if we took it away, customers would come in our chat and be like, where's that thing you built? I was trying to use it. Or where's this timer? Where's that? And we'd be surprised because we'd never talk about it in a sales call, or we'd never talk about it, or no one would mention it. But he was just so attuned to what was going on in the pharmacy that everything we build was so intentional. It's really inspiring, honestly, to work around Michael. I think we've lost maybe one team member, and I read something he wrote in a message to our entire company, and one of the things was he said, Michael has a humble geniusness to himself, which I fully agree with. And it's really inspiring to watch and to be around. It makes you want to be better. It makes you want to work at the same caliber and try and put your best foot forward and build the best things you possibly can for the customers we have.
Before I joined MedEssist, I actually was a pharmacy assistant. So I worked at a pharmacy in Calgary, and I worked at a central fill location, which means that we weren't actually patient facing, but we did a lot of the filling blister packs, filling prescriptions, all the works, all the things that go on behind the scenes. So I worked, with pharmacists, pharmacy techs, and got a good feel for kind of the workflow that exists in pharmacies. So I think I was convinced to join MedEssist because I was kind of looking for something that had an impact on the healthcare industry, but wasn't necessarily directly on the front lines, if you will. So it was really interesting to me kind of what their mission was. Yeah, so getting to work directly with the founders of a company, in our case, Joe and Mike, they're co-founders. It's a really, really great experience. Both of them are just a wealth of knowledge between the two of them. Mike has a little bit more of that pharmacist perspective, and he builds everything really with our users in mind and from his own experiences and kind of his peers' experiences. Then Joe, of course, has so much, business knowledge on how to kind of keep our company running smoothly and efficiently. So between the two of them, it's been a huge learning opportunity to work so closely with them. And working directly with the founders, they're obviously very mission driven. The company is, their baby, if you will. And so it's really cool to get to see people who, there's such a purpose behind everything that they do. That being said, you also get to kind of see the thought process behind every decision that gets made. You understand like the why behind everything, and mission kind of really does stand behind every decision that gets made at MedEssist, which just makes the work feel so much more impactful, which is really nice.
The journey of co-founding MedEssist has definitely affected my personal life and other relationships. Co-founding a company is really hard. Especially if you're doing well. And that's sort of counterintuitive to what you would think. You would think that if, the company is doing well, everything's okay. But by definition, going back to the start of like what a startup is, it's disruptive, it's scalable, it's growing really fast, and we are all of those things. And so you're constantly having to live through the chaos. There's no real downtime. There's no real time for... I feel like I've fallen off a cliff with all of my closest friends. I mean, again, my closest friends are my closest friends. They understand. But I don't have time for them. Definitely not. Because the business constantly needs me. And very often, I think for both Michael and myself, we have always had to put the company first. We've always done that because we're responsible to our team. Like, as much as we are doing this journey and we're co-founding the company, the team is coming along for that ride. The team is not working anywhere else. They're working at MedEssist. They believe in MedEssist. And so we have a responsibility to do our best and make sure that the company is growing and make sure that it's worth the risk for everyone. And we have a responsibility to our customers. That became evident right from day one. A lot of our customers would tell us about things that were changing in the public health system, or the next day, or a new executive order that would come out. They would literally tell us at 1 a.m. in the morning or 2 a.m. in the morning, or they would write us an email. And that showed how many customers trusted us and put their faith in us and believed that if they gave us the heads up of something that was coming, they were doing that because they thought like, oh, MedEssist is going to build a good solution for this. They're going to help us with this. And so when you have that many people trusting you and relying on you, it's pretty damn hard to go on, managing personal relationships outside of work. But it's a balance. I think we're getting to a place where we have finally grown our team. I think we're 20 plus people now. And so there is starting to be other people joining us on that responsibility journey and helping us take some time off and actually take vacations, which is nice. But it's not easy. It's not, and I don't think it's ever going to be easy, frankly. I think it's just the nature of what we've taken up. We do a couple of things to manage our own health. I think Michael plays soccer and we're always worried about him breaking a leg, and I ski, so he should be worried about me breaking a leg. But it's really hard. MedEssist's long-term aspirations is to try to enable more pharmacies to turn into pharmacy health clinics, which is a completely new word. It's a completely new invention. It's this mix of a pharmacy and a walk-in clinic or a healthcare clinic together. And the reason we're doing that is because we want to build consistency with how patients access their healthcare. Because right now, there are places in the US and around the world, really, where you and I could be living 30 kilometers from each other or 10 miles from each other, and we'd have access to different healthcare based on whether we can drive there and who's accessible and what that state offers and what that county offers. And that seems unfair. It seems inaccessible. It seems like an unnecessary barrier when you have a pharmacy on every block. And so a big part of our journey is going to be scaling MedAssist all across the world, really. We want to be and we want to have pharmacy health clinics in Canada, the US, the UK, Australia, Spain. Wherever there's a pharmacy, we want to be able to have a presence so that we can start to impact more patients' journeys on a global level and start to build consistency into our healthcare system.
The main thing I want to know about the community that ask a pharmacist whenever they have any healthcare need, or whenever they are looking for their doctor even though it's emergency or not emergency, just ask a pharmacist. The local pharmacists help a lot, and we are not only helping them, we are helping government as well for saving healthcare cost, because a lot of minor issues can be managed by a pharmacist when they visit local physician or walk-in physician. It costs a lot to our healthcare system. Ask a pharmacist. We can help a lot.